Think of our eyeball as a closed container filled with fluid. Every closed container filled with fluid has a fluid pressure. When I talk about this pressure, it's not a pressure you can feel. I think a lot of people have heard about glaucoma, have heard the word glaucoma, not really sure what it is.
Hello, welcome to Visionary Voices in Optometry. I'm excited to have you here today. My name is Mark Donison. I'm the CEO of the Ontario Association of Optometrists. We're going to be speaking about a really important topic today called glaucoma. January is the Glaucoma Awareness Month, and with me, I have Dr. John Mastronardi. He's a practicing optometrist in Windsor, and I'm excited to have him here today. John, welcome.
Thanks, Mark.
Super thrilled to have you here.
It's great to be here and happy to do some education for the people of Ontario, help them better understand this condition.
Perfect.
Glaucoma.
Awesome. So let's start off by having you introduce yourself a little bit more. So how did you get into optometry?
I had poor vision, unfortunately, growing up, starting in grade school. Had difficulty to see the board. Became very familiar with routine exams and seeing my optometrist as a child. Seemed to be a profession that kind of intrigued me. I was always kind of fascinated with math and sciences, and just getting to know my optometrist really well. I decided to explore it, and very happy that I did. Love my profession.
Awesome. Well, I'm so excited to have you here, and thank you for making the time to join me. Let's start off with a little bit of conversation about the general understanding of glaucoma. So can you explain what glaucoma is, and why is it often referred to as the silent thief of sight?
Yeah, for sure. I think a lot of people have heard about glaucoma, have heard the word glaucoma, not really sure what it is. So we'll describe it this way. It is a disease that damages the optic nerve, which is the cable that connects the eye to the brain. All the information your eye receives travels through that nerve to the brain. If we lose that cable that connects the two, we lose vision. And so what happens is some patients will develop a pressure problem in their eye. So think of our eyeball as a closed container filled with fluid. And every closed container filled with fluid has a fluid pressure. Now, inside our eye, we have a faucet that's constantly making fluid. We have a drain that's constantly taking that fluid away. And in some people, we don't know why it specifically attacks some people. In most cases, why that happens, but their faucet's either running a little too quickly or the drain's getting plugged up and doesn't keep up. So either way, they're getting more fluid into the eye than is coming out, and that fluid pressure starts to build. And that nerve I just talked about, the one that connects the eye to the brain, can't live in a high fluid pressure. So if that pressure builds, it can damage that nerve. Now, why do we call it a silent thief? Because when I talk about this pressure, it's not a pressure you can feel. So you're not walking around feeling a pressure, your eyes are aching. People are walking around with high eye pressure and aren't aware of it. So they could be losing that optic nerve, developing damage without being aware of it.
So that's a very interesting point to bring up. I'd like to explore that a little bit more as well. So you say that people don't necessarily feel the pressure in their eyes, right? And so what would some of the early warning signs of glaucoma be, and how can patients recognize them then?
So great question. And I guess to dive into that, there are two forms of glaucoma that we'll commonly hear about. One we call an open angle glaucoma, and one a narrow or closed angle glaucoma. Now the first one, open angle glaucoma, is one that is the most common, and over 90% of people with glaucoma have that form of glaucoma. Unfortunately, there are no early symptoms. There are no headaches, blurred vision. The only way this is picked up is through the routine eye exams. So super important, and we'll talk more about that later, about the importance of eye exams. But the second form, the more rare one, can be really a frightening one, because someone could come in with a normal eye pressure, they don't have any problems, and then they have what we'll call an attack, a glaucoma attack. And they could go from having a normal pressure to an extremely high pressure in a matter of hours. In those cases, there are a lot of symptoms. There's blurriness that comes on from nowhere, extreme pain, eye pain, headaches, nausea, red eyes. There's no question when people have one of these attacks that something is wrong, and the proper path there is to get into their optometrist right away or to an emergency room. They've got to be seen right away.
How is glaucoma typically diagnosed then, right? And so people, if you don't really see it, right, it's not that obvious, right? And so what kind of tests would you use during a comprehensive eye exam to detect that?
So there's a number of tests. A lot of patients who've had an eye exam will be very familiar with the pressure test. That's done a couple different ways depending on the optometrist's office. Could be that dreaded puff of air that you get to the eye. Others will use drops or different devices where they'll actually make contact and touch the eye to measure the pressure of the eye. So one of the first tests, most common tests, is to measure the pressure in the eye. But that alone doesn't tell us enough information. So a lot of patients will come in and say, what's my number? And they think that will tell them if they have glaucoma or not, but it's only one piece of the information. So we also will take a look at the inside of their eyes. And that's very important to do because I mentioned earlier, this is the disease that damages the optic nerve. So we've got to physically look at that nerve. And there's different telltale signs when we look at an optic nerve, if it's a healthy one or one that's undergoing damage. So we've got to look at that nerve. We have another test, peripheral field test. And this is important because when the optic nerve starts to get damaged, one of the first things it will do over time to our vision is start to destroy our peripheral vision. So we have a test to measure that peripheral vision, and another test that patients don't always love, but it gives us a lot of useful information as to how that nerve is functioning. And newer technologies, not so new anymore, but newer, would be different types of scans, and specifically what patients will know as an OCT scan. This is a scan that gives us a really detailed measurement of the optic nerve thickness. It will look for subtle changes over time, help us decide if that's a healthy nerve or one that's starting to go through some trouble.
So just sort of building on that, there are obviously then lots of different signals or signs that you as an optometrist would see, right? So it's the pressure, it's what, and so when you talk about looking at the optic nerve itself, what would you actually see when you're looking into the eye?
So we'll start to see a number of things. We'll start to see the tissue actually erode. So we'll see an area we call the cup in the optic nerve. It will start to over time get larger, and that's a sign that there's increasing erosion and excavation of the optic nerve. The nerve will start to get pale. It'll change in color. It'll start to look unhealthy. So it's really all of these tests combined that will take all of that information and decide if somebody is still just at risk for glaucoma or they're going through it and treatment.
Right. So those are the things that are not obvious to the naked eye, might you say. So you need actually the proper technology and equipment to be able to
absolutely. Now that's the really main message here today, the importance of routine eye exams to detect this disease early.
So speaking about routine eye exams, and what's your view on how often people should actually get their eyes checked to catch this early?
So there's a number of factors, risk factors for people that are at risk for glaucoma. And that's an important thing to talk to their optometrist about. I would say patients with risk factors absolutely should have an annual eye exam. An optometrist might be comfortable if we don't see any of those risk factors, suggesting every 2 years for a routine check. Let's talk about some of those risk factors, though. Number one, first and foremost, is age. Now, a lot of people don't realize you can develop glaucoma at any age. In fact, you can be born with glaucoma. I think the numbers are somewhere in the 1 in 10,000 children are born with glaucoma. So it's rare, but it happens. But you can develop this, in early adulthood. I'll remember a 28-year-old patient came in, she broke her glasses, routine check, ended up having advanced glaucoma. She had no symptoms like we just discussed. I did ask if she had any siblings. She had 2 younger siblings. We brought them in, and sure enough, all 3 of the patients had glaucoma under the age of 30. But age is a big risk factor. Once we're over 60, 65 years of age, the risk definitely goes up. So into our senior years of life, absolutely an annual eye exam is important.
Do you see other risk factors that people may want to be aware of? Is there a hereditary point or
that's
things?
Right. So age is a big one, an important one, but not the only one. So absolutely, you touched on a great one. It seems to be a genetic predisposition. So if it runs in your family, we do know that you should be seen again absolutely annually if you have a family history of glaucoma. We do know patients of African, Asian descent have a higher risk, up to, I think data shows up to 8 times higher risk of developing glaucoma, so very important there. Patients with a really high prescription, really nearsighted or really farsighted, also at higher risk. And certain medications, steroid medications is a great example, whether it's oral, whether it's an inhaler, a puffer, or whether it's a cortisone cream that people are using on their skin, can increase the risk of developing glaucoma.
Fascinating.
Yeah.
So let's move on to treatment and management. So in the unfortunate instance where somebody would come in and be diagnosed with this condition, what happens then? So in terms of treatments, what options do people have to treat glaucoma?
So I think this is a really great question, really important one, because one thing I really want to highlight here is damage that happens to the optic nerve, be it glaucoma or another condition, but let's talk about glaucoma, is permanent. So any damage that happens is irreversible. So it is important to catch this early and to treat it early. And so most commonly, we'll see treatment begins with medication, and very often it's eye drops, and it might be a once or twice a day dosing that patients will be asked to use. They will be, unfortunately, using those the rest of their lives, but they're very effective. And we're seeing that if you catch it early enough and catch it before patients lost any vision, they're able to preserve that vision the rest of their lives. So medications often a first line of therapy, not the only. There are some practitioners, some ophthalmologists that might be able to initiate some laser therapy. So we talked earlier that we've got this faucet that's running too quickly or a drain that gets clogged up. Yeah. Different eye drops work different ways. Some of them are geared towards turning down that faucet. Some of them help open up the drain. So they work differently. Lasers are designed to open up the drain. So they'll take a laser, go try to open up the area to help the flow of fluid out of the eye, lowering the pressure and reducing the risk of damage to the optic nerve.
Lots of options that you have to consider then.
There are lots of options, and that's a good thing for patients, right? That there are options. And so the only thing to fear is not getting checked for it and being diagnosed too late.
Right. How do you then monitor the progression of glaucoma in patients? And so as you mentioned before about the pressure, right? So what does regular eye pressure measurement play? Like what's the role that it plays in the treatment?
So, very similar to what we just discussed in terms of how you diagnose glaucoma, those tests are all equally important in monitoring the disease as it progresses with time. So checking the pressure, and again, an optometrist will decide how frequently that needs to be happening based on risk factors and how well a medication is working for a patient. Let's call it 2 or 3 times a year. If it's working well, that's an important piece of information. But we would still want to scan the optic nerve, scan the retina, look at those changes I was talking about earlier with an OCT. We would want to repeat that visual field exam annually. And obviously just look at the nerve. So all of those tests that we use to diagnose it are all equally important in managing this disease as time goes on.
Right. So you mentioned earlier on about the dreaded puff in the eye when you're doing your pre-test, and then you mentioned as well about a number that you see, right? And so is there a range then in terms of eye pressure that people would be sort of monitoring or keep an eye on?
So there is, and this is why I earlier mentioned to you that the number alone isn't enough. Okay, so if we, a typical range, you might hear what might be a normal pressure might be 10 to 20 millimeters of mercury. So that would be considered, by most practitioners to be a somewhat normal range. But that number isn't enough. And what do I mean by that? We could see a patient who has a pressure of 24 or 25. That could be normal for them. So even though their pressure is above that normal range, it's not enough to damage the nerve. So they don't actually have glaucoma, but they're monitored to make sure because they're at risk for it with that high pressure. Similarly, you could have a pressure under 20, call it 17 or 18, and that number is too high for that particular patient. So they might have something we call normal pressure, normal tension glaucoma. And so it is important to do those other tests, and that's why we say that number is important, but it's not the standalone to help us. In terms of where does that pressure needs to be, a lot of that is determined by what the starting pressure is at the beginning of treatment. Often we might be targeting a 20-30% reduction in pressure. So the practitioner, the optometrist, is going to set that kind of target of where we want to be. And so when the patient's coming in for routine checks, we're going to make sure that they're where they should be. Right. And if we're talking about treatment again, I think it's important to note that why we do these ongoing pressure checks is we might find a drop that's very effective for a patient and it might work for a number of years. Suddenly they come in for a routine check and that pressure starts to climb. They're not doing anything differently. They're taking the same medication, but it's not as effective for that patient. And so they might need a change in mechanism or a change in medication that is a different mechanism to help lower the pressure.
Right.
So a lot that goes into managing, to both diagnosing and managing the condition. But again, lots of options, a lot of great technology. So, no reason for patients to lose vision today from glaucoma as long as they're armed with this information about the importance of routine checks.
Right. So let's move on then to the notion of the impact on the quality of life for someone. So they're diagnosed with glaucoma. How might that condition impact the patient's vision? And then their overall quality of life, especially if it's left untreated.
Yeah, those are the visits we never enjoy. Someone that has lost vision, either they got diagnosed too late, or it was a challenging case where traditional therapies just weren't working as effectively for them. I don't know that there's really a big difference in how you lose your vision, but losing your vision, I mean, we know that people value that organ in that sense almost more than any other in the body. There's, a lot that impact. I mean, we see this impact life in dramatic ways, and it's really the loss of independence that is the most challenging for people to deal with. So that might mean losing their driver's license. That's a big one, and that's a hard pill to swallow for people that feel that that their life independence revolves around being able to drive. But their hobbies, the things that they love to do, you lose your vision. Basic things that we take for granted on a daily basis, preparing a meal, doing our chores, or reading a book, watching our favorite shows. All of those things can be impacted. So we really take our job as optometrists very seriously to know that really we are those warriors trying to help preserve vision for people so they can not just live long, but live a fulfilling life.
Right. And it's so poignant as well when you think at the time that we're doing this recording, everybody's come back to work and back to looking at screens. And, as you pause sometimes and you reflect on what life looks like, right? That it's appreciating the significance of the vision that you've got, right? And how much we rely on it for so many things.
Almost everything we do in a day.
Yeah. And then so sort of building beyond that, then, so what advice would you give patients who are newly diagnosed with glaucoma to help them adjust to their diagnosis and the treatment plan that they would be facing?
Yeah, that's another great question because I know I've experienced it. I know some of my colleagues across the province have experienced this. Sometimes trying to communicate this diagnosis to a patient is challenging because, again, they come in, they don't feel they have any problems. They can see what they want to see. Their glasses, whether they use them or not or need them or not, are working. They're not having any problems. They're not having any symptoms. They're not having pain. So to get them to understand that they need to begin these medications and treatments when they feel like everything okay is sometimes challenging. So number one, it's really important that they've got to do maybe a little bit of homework to better understand the condition, the importance of the plan, because if they don't buy into it and understand, that's where we see challenges, where they might not be as vigilant taking their drops. Very important that they're not just prescribe them, they're taking them on a regular daily basis without missing them. So very important that they understand it and just work to understand your test results when you're with your optometrist. You're not just doing these tests, but become an active participating in your own care and take a look at the results and know that the work that you're doing is paying off and it's helping to preserve your vision.
And then this condition never improves or never goes away, right? And so the treatment plan that you have is something that people will have to get their heads around for the long haul.
Yeah, the way that things are right now, that's correct. Now, there are some cases where, the pressure, and I alluded to this earlier, might not be really high. They might have just a really early form of glaucoma where the patient might be able to just have laser therapy to open up that drain, and it might be enough for a period anyways to keep them off any eye drops. But again, they've got to be monitored to make sure that this kind of insidious disease isn't sneaking back into their lives. But typically, once you're on medications and sometimes you're doing laser and the drops together, you've got to be monitored. One thing we didn't discuss is what happens if those don't work. While they're very effective, there are a small percentage of cases where over time they just don't control the pressure enough. And so there are cases that we will refer to ophthalmologists that the patient might benefit from a surgery where they'll go in and actually help surgically open up the drain and help fluid out of the eye to help lower the pressure. So that's kind of our end stage treatment if the other ones aren't working. But most patients are able to avoid that treatment.
Right. So sort of along this similar lines then, let's talk a little bit about the advances in glaucoma care, right? And so as you're talking about it, right? So how does the role of an optometrist differ from the role that an ophthalmologist would have in the management of glaucoma? And what kinds of cases would you see where the referral to an ophthalmologist is necessary?
Yeah, I think we touched a little bit on this. So today in Ontario, optometrists are not only trained and educated on detecting the disease, but also early intervention and managing it with prescription eye drops. So we are able to manage those in-house without often needing to refer a patient. But again, sometimes the drops aren't enough. They do need laser therapy. So currently right now, if a patient does need laser assistance to lower their pressure or surgical intervention, those cases absolutely need to be referred to our ophthalmology colleagues who are busy in the OR rooms helping the people of Ontario with a number of eye conditions. So those would be the types of cases. Newer medications are coming out all the time that are more effective. So we're always watching out for those, trying to find medications that minimize side effects. Any medication has the potential for side effects, and there are some drops that work really well at lowering your pressure, but they also create a lot of eye irritation or symptoms for patients where they don't tolerate them well. So we're always on the lookout for more effective and less bothersome treatments for patients.
Right. I'm going to wrap up on one last topic here on public awareness and education. Speaking with colleagues and friends, you mentioned the word glaucoma, and people go, "Oh, I've heard of that." And then when you sort of explore it, you ask, "Well, what is it?" Very few people actually understand or know what it is, right? And so when people hear that term, what do you think some of the misconceptions are about glaucoma, right? And what do you often hear back from patients, and how would you address those misconceptions with them?
Yeah, I think the thing that surprises patients the most is when we actually tell them that they've got risk factors or they have glaucoma. They're not often coming in because they think they have it. They're coming in for a different problem. And so really getting that message out that really everyone should be getting their eyes examined. You can't look at someone across the room like this and say, you might have glaucoma. You've got to get an eye exam to be screened for that. I think it's important for patients who do have a diagnosis of it to share that diagnosis with their family members and urge their family members to get in and be screened for it. Because again, as we talked earlier, they're also going to be at elevated risk for that. But, that's why we're doing podcasts like this, try to raise awareness, help people understand. There's really nothing to be afraid of about this condition other than not catching it at an appropriate time. And so really, in my opinion, there's no excuse for that today. OHIP, the Ontario Health Insurance Plan, covers visits for patients who have glaucoma. So once you are on treatment and you need those regular pressure checks and things that you need, those visits are covered under OHIP. So get your eyes checked and don't let the silent thief take your vision.
When people think about going to see a doctor or a dentist, an optometrist, there's often a bit of a fear factor involved in that. So what would you say to someone who is hesitant about going for an eye exam due to that fear or the lack of symptoms?
Yeah, we see that. We see that all the time. Sometimes they're afraid of our tests, the unknown, and sometimes they're afraid of a potential diagnosis that they might be told they're going to lose their vision. I think the message we want to get out is that they can be told that we're able to save their vision, that they're not going to lose it because we caught it early enough. So we just can't emphasize that point enough. There's just no need to lose vision from this condition. They've just got to get it out out that word out there to your family and friends. Get this checked, and really just nothing to be afraid of. The tests don't hurt. They annoy people. People don't like our bright lights. They don't like our puff of air. They don't like clicking little video game flashing lights on the side. But at the end of the day, you give them the choice of that versus lose their vision. They'll have any light. They'll do any test to do anything to preserve their vision.
John, this has been an absolutely fantastic conversation. Thank you so much for that. Glaucoma is absolutely a silent thief of vision that doesn't present itself early on, right? And so your point there about making sure that people come in for regular eye exams is absolutely critical. Is there anything else that you'd like to touch on before we wrap up?
Oh, I think you've asked all the great questions. They're very similar questions that we get asked by our patients who want to know more about this condition. So I thank you for the opportunity. I hope this podcast helps some of you viewers out there better understand the condition. And if we save one person's vision from this, then boy, was it worth it to be here today with you, Mark.
Awesome. Thank you so much for joining us.
Okay.
For everybody watching today, thank you for joining us and listening to this very important topic. It's absolutely critical. If you haven't had your eyes checked for a while, if you're putting it off, now's the time to do it. As we've heard today, that eye conditions don't always present symptoms, and they're not recognizable unless you go in to see a specialist, unless you go in to see highly trained optometrists who are specialized in understanding and treating eye conditions. Now's the time. Go and get your eyes checked. Thank you so much for joining us. Again, John, thank you so much for spending the time with us. Really appreciate it. Visionary Voices in Optometry. That's a wrap for today. Thank you so much.